Hey everyone, and welcome back. I'm Mike Wade. Thank you for tuning in to Dissect and Connect, a podcast where we explore population health issues impacting your community. This podcast is a service of Montgomery County Prevention Partners and New River Valley Community Services. Our podcast is made possible by a grant from Carilion Clinic. The views expressed in this program may not reflect those of Carilion Clinic. Emily Cook is a registered dietitian through the Commission of Dietetic Registration and a member of the Academy of Nutrition and Dietetics. She graduated from Virginia Tech, where she received her Bachelor of Science and Master of Science in Human Nutrition, Foods, and Exercise. She completed her dietetic internship at Virginia Tech as well. Before starting her own private practice, Emily consulted for a weight management program in Princeton, West Virginia, where she witnessed firsthand that good nutrition and retraining one's mindset around food can make lasting results. Having grown up in Southwest Virginia, Emily has called Giles County her home for the last 30 years. With her new practice, Cook Nutrition, Emily aims to provide practical and beneficial nutrition education to her community. Knowing that access to healthcare can be limited in Southwest Virginia, she desires to make a difference by educating her community about proper nutrition and improve people's lives. Emily lives in Pearisburg with her husband Ricky and their 3 children, Kate, Clay, and Luke. In her free time, Emily enjoys chasing her children around, hiking in the beautiful mountains of the New River Valley, and cooking nourishing meals. Emily, welcome to the show. Glad to have you here. I want to start by touching upon the thing that pretty much everyone these days is talking about, and that's the COVID-19 pandemic. So I wanted to ask how you've been impacted personally by the pandemic.
Hi, Mike. Thanks for having me today. Yes, the COVID-19, I think that has us all talking, especially being a healthcare provider. How do we still, provide for clients during a time like this? Who's considered essential, who's not considered essential.
Right.
And from a nutrition standpoint, being a registered dietitian, a lot of people are facing a lot of nutrition implications during this time.
Mm-hmm.
Stress eating being one of them. I've had a lot of clients who have struggled with this, being at home, having just a complete different schedule, working from home, being a teacher to their children for some of those who with kids, being, just a complete switch of normalcy, I guess. But one thing that we all have in common is we all have to eat. And sometimes this is struggling, it can be a struggle for individuals who are so used to getting up, getting out the door, going to work, kind of having their normal breakfast, lunch, and dinner, coming home. Now, if we're all at home, it's kind of like, where does the eating fall into play?
Right.
And for a lot of my clients, it's, trying to keep that new schedule kind of very similar to their old schedule and still making their meals, healthy and eating to nourish. And it can be done. And for myself, I have found struggles as well. I have 3 children. And so I'm trying to work from home, and then be a teacher and, still having meal times at, I think it's best just to try to maintain your schedule that you're used to as best as you can, even when you're at home.
Right.
And that's what I would recommend. And it's helped me. And yeah, there has been struggles with not drinking as much water. I've noticed myself, it's 11 o'clock and I've had 2 cups of coffee and I haven't even picked up my water bottle.
Right.
And, it's just being very aware of what you're eating, why you're eating, when you're eating, and just being more tuned into it while you're at home.
Yeah, absolutely. So why did you choose this as a career path?
Yes, so nutrition. Nutrition was not a big topic of conversation 10 to 15 years ago. I knew I wanted to do something in the healthcare field. My mom is a pharmacist and she served our community at McLean Drug and then at Rite Aid, and now she's at Carilion at the hospital. And growing up in the healthcare field, I knew that I wanted to help. I knew I wanted to do something in the healthcare field. And I thought I was actually going to go to medical school. So I went to Virginia Tech, and that's where I had my first nutrition class. And after I had that first nutrition class, something just clicked. And I thought, you know what? This is so important. We do this every single day. this is something everybody has in common. And this is something that I could really do to help. And, growing up in Giles County, I knew that I wanted to stay. I got married to my husband, Ricky, and we're both from Giles County. We knew we wanted to stay in the area, raise our kids in a small town. So that's how it all started. I went to Tech. I got my 4-year degree in human nutrition, foods, and exercise. I stayed for my master's. And then I did my dietetic internship at Virginia Tech, and I was able to go around all over the New River Valley to Princeton, West Virginia, Danville, Virginia. And I was able to complete that internship and get the real life experience before I did it on my own. And then from there, I got a job in Princeton, West Virginia, working at a gym, working for a weight management company where we saw probably, I would say 200 to 300 clients a year who wanted to lose weight. And insurances were paying for this. And I started thinking, wow, these insurance companies are covering these costs. I'm going to start looking into this. So I started doing some research, and over the last year, I realized that insurance companies are now covering these preventative health services, and it's part of your premium that you pay every month. That insurance companies want us to be healthy. They want individuals to utilize these healthcare services that are preventative, and that's where nutrition counseling falls into play. So I found out, and I thought, you know what, this is great. This is a service that I can offer to my community. Most insurances cover it, so people don't have to pay for these services. And I think it would be very beneficial for those who want to learn about the foods that they're eating and how to feed their families.
Yeah. Well, I think even before the pandemic of COVID-19 came into play, our society was plagued by another epidemic, and that would be obesity. And just people with generally poor lifestyles as far as health goes. And I think that is particularly true in communities like rural Southwest Virginia. Can you talk about some of the unique challenges that areas like the New River Valley face in being able to seek good nutrition and maintain a healthy lifestyle?
Sure. Yes, growing up and living in this area, like I said before, nutrition wasn't a big deal. I grew up on Pop-Tarts and Five Alive and fish sticks and all these foods that you would look at, you would think now as unhealthy foods because it wasn't such a big deal that long ago. And then as we've gotten older, researchers have done, the research behind this, and it's showing that the foods that we eat directly can be a positive or a negative impact on our health. And that's where, I come into play and I can explain, what is in these foods that you're eating. But I understand the challenges being raised in Giles County. I understand that, cost is a big factor for people when they go to the grocery store.
Right.
But my biggest thing is all healthy food is not expensive. There is this, persona that everybody thinks to eat healthy, you have to spend a lot more money at the grocery store, and it's not true. Mm-hmm. There are foods that are termed healthy, and yes, they are a lot more expensive than other foods, but you don't have to choose those foods. There's plenty of other foods that are inexpensive that are termed healthy. For instance, peanut butter and eggs and beans, bananas, all these foods that are very inexpensive when you go to the grocery store can be part of a healthy meal.
Mm-hmm. To add to the problem, we now have the challenge of going out in public right now and going to the grocery store and having to be a little more measured and careful about how we do that. Any advice about that aspect?
Yes, my biggest advice is planning your meals. I think from a nutrition standpoint, before COVID-19, this is a huge thing that I work with my clients is planning, meal planning. We're so much more apt to follow along with anything if we have a plan, no matter if it's eating healthy or anything in life. If you have a plan, it makes everything go smoother. It makes you stick more to your plan. So instead of running to the grocery store every time you need something for dinner, I had some clients who would run to the store every day, for their dinners. And now, just for safety precautions, planning your meals out 1 to 2, weeks at a time would be my advice to everyone, and just sitting down. For me, it's Saturdays. Every Saturday, I sit down. Me and my husband talk about what the foods we want to eat throughout the week. We involve our children. I think this is something very important that you can do. A lot of times parents don't think to involve their children in meal planning, but I think it's a good time to say, ask your kids, what kind of fruits and vegetables do you want this week? What do you want mommy to pick up at the store? What do you want daddy to get? You can involve your kids in things like this.
Right.
And I think a big thing too is consider what you have in your pantry. What do you have on hand? What kind of meals can you make? Frozen foods can be your friend. A lot of people, instead of running, as soon as they found out, they ran and got all the canned and non-perishable items off the shelf. And even I did that. I mean, I went and did a big grocery run, and I got a lot of shelf-stable items as well. But you can still make healthy choices with shelf-stable items, such as beans and rice, crackers, canned tuna and chicken. And then you can move to the frozen section as well and get frozen fruit, frozen vegetables, frozen chicken, fish. And then when you're thinking about non-perishable or things that have a little bit longer shelf life that still require refrigeration, eggs, yogurt, milk, and then some of those more hardier fruits like apples, oranges. I get bananas every week, and then when my bananas go bad, I make banana bread. So it's kind of working your meals around foods that are a little bit more shelf-stable, but not as, not so high in sodium.
Right.
That's one of the biggest things from a nutrition standpoint is the sodium content when we're talking about shelf-stable products. Food manufacturers have to add salt and preservatives to these shelf-stable items so they can be good for a couple of years if you look at the expiration date. So if you have high blood pressure, that's something especially that you need to watch out for, because a lot of foods have, a lot of those canned foods are higher in sodium. For instance, I went to the store the other day and I looked at a can of chicken noodle soup, and it had 1,500 milligrams of sodium in one can.
Wow.
And that is about the limit that you want. You don't want to exceed that if you have high blood pressure.
Right.
2,300 milligrams if you don't have high blood pressure. But some of the canned and frozen foods do have that, listed. But you need to look on the nutrition label and scroll down to where it says sodium. And anything over 300 milligrams of sodium is considered a high source of sodium. So just be on the lookout for that. That's something that even switching a brand or even switching a different product you can save yourself drastically in the sodium content.
And sodium, is that probably, based on what you're saying, is that more important to pay attention to than necessarily the calories or the fat?
Yeah, so it's all individualized, but sodium is a huge player in heart health. Mm-hmm. So when we're talking about our heart health, if you have high blood pressure, you're putting strain on your heart. So sodium is one of those things that I tell everybody, even if you don't have high blood pressure, if you have a family history, or if you have someone else, in your family who has high blood pressure, or you yourself has high blood pressure, you have a stressful job or you're in a stressful time like we are right now, sodium kind of adds on to that. Yeah. And you just kind of want to discontinue all that sodium if you can. And, try to not use that salt shaker when you're preparing your food. Some easy tips that I like, anything with the powdered version. So instead of using garlic salt, use garlic powder. Instead of preparing anything with extra salt, look more for spices. So oregano and basil and all those dried spices that you can get, they are salt-free and they can really flavor your foods. My go-to is Mrs. Dash. It's a sodium-free substitute, and they have all sorts of flavors. So a lot of people think you have to add salt for taste, but that isn't so.
And then, too, I think the advent of technology and social media and all these websites and cooking shows, there are an endless supply of recipe ideas and ways for you to learn how to fix meals that maybe you wouldn't necessarily normally do. So I think the opportunity to be a little more adventurous and expand your palate is certainly there. Wouldn't you agree?
I would agree. We have more time to be at home, to experiment with more foods that normally we wouldn't have time with. So I think this is a good time to start, experimenting with some healthier recipes that we're not used to making. For instance, I had a smoothie recipe the other day that I shared with some of my clients. And you can have, frozen fruit in your freezer. You can buy yogurt. Yogurt has a fairly, stable shelf life for a couple weeks.
Mm-hmm.
A splash of 100% fruit juice or low fat or skim milk, and you can make an easy smoothie at your house. So
yeah, you've touched upon this a little bit, but I wanted to talk a little bit more about the importance of the food that we take into our bodies and how that makes us feel overall.
Sure. I think the biggest thing is, if you put good in, you're going to get good out.
Yeah.
If you eat salty, heavy foods, it kind of weighs you down. You have some sodium retention, your fingers, your feet can kind of swell the next day. And if you're not drinking enough water, which is it's a big thing right now. I think water intake is huge. 64 ounces minimum throughout the day if you're doing no sort of activity. So, which for most people who are sitting at home doing work behind a desk, it's one of those things that you're not being as active as maybe you normally would be. I've counseled a lot of teachers lately, and they say, I'm used to always being on my feet. I'm walking down the halls with my students. I'm going back and forth to the copy room. I'm constantly moving. And now I'm sitting, I'm sitting at home. I'm not being very active. And they say they just don't feel as good as what they did.
I hadn't even thought about that, but that's very true. Wow. Yeah.
Yeah. And I think it's just important to, set a reminder on your phone or do something every couple hours. Get up, get away from your desk. Take a walk around the neighborhood. You can still get outside and be active, even though we need to social distance ourselves. You can still walk around your neighborhood just to get some fresh air. It's amazing what fresh air can do. A little bit of sunshine is good for the soul.
Absolutely.
And if you feel better, you're going to eat better. If you put good in and you continue to do well, it's amazing what it can do for our mental health, and it helps us to not stress eat as much as well.
Yeah. Well, you just touched upon the next area that I want to cover, specifically mental health, since we are recording this and it will air during Mental Health Month, which is in May. Can you talk a little bit more about how the foods that we eat impact our mental health and our well-being?
Yes, I think a big thing is realizing, why you're eating, what you're eating, when you're eating, and just realizing the foods. Food is to provide us energy. Food has calories, and calories is defined as energy, and so we need to eat to nourish our bodies, to give us energy, to give us strength, to improve. Just to improve ourselves throughout the day. I think you've heard breakfast is the most important meal of the day. There is some truth to that from an energy standpoint. As soon as you wake up, you need to put a good meal in your body to give you some energy to go. It's one of those things that we live in a culture where dinner is sometimes the biggest meal of the day. And dinner is one of those things that, you eat and then you're not very active after dinner, and then you go to bed, and you don't really need all that energy right before you go to bed.
Right. I guess the other side of that is a lot of research shows that folks with chronic mental health issues tend to die much younger and much earlier than their counterparts. Some studies have suggested that it's as early as 20 to 25 years younger than their counterparts. So I know that just from experience and working in the field, that a lot of folks who we work with at NRVCS who have mental health issues also have those additional physical health issues and ailments. So maybe just to talk a little bit more about the importance of how the food that we eat impacts our mental health.
Sure. I think, from a nutrition standpoint, eating is something that everybody does. Eating is something that we all do multiple times a day, something that we all have in common. But people who do struggle with addiction and people who are more susceptible to mental illness, eating can be right there with that.
Yep.
I have a lot of clients who look at food as kind of a an addiction for them. And the thing about food is you can't just take it away.
Right.
Food is everywhere. Food is during happy times with celebrations, weddings, birthday parties, and also at sad events as well when people provide meals for people that are going through a hard time. So from the nutrition standpoint, learning how to cope with understanding why nutrition is so good for our bodies and understanding that, food is not something that you need to eat for an emotional sense. I have quite a few clients who view food as kind of their out or as their, they feel like they need to stress eat to, I guess, prevent them from doing something else. And,
Right.
I work with clients on changing that mindset around food and thinking of food as more from an energy standpoint. Our body needs food. The good food that we put in, we're going to be more apt to get good out. So I think mindful eating is something that you hear these days. It's something very important. Just checking in with your body. What does your body really need? What are you eating? Why are you eating this? When are you eating this? Does your body need this?
Right.
Are you not used to eating breakfast? Okay, let's talk about that. Let's figure out why haven't you been eating breakfast? And a lot of the times it's habits that we develop. Even, from a small child, I have clients who say, I think I'm doing these habits because that's what I was taught. So sometimes it's just relearning new habits, to learn how to eat healthier, to provide, for our bodies and what we actually need.
I'm glad you brought that up because I really do think in a lot of cases our relationship with food is generational.
Yes, I agree.
Yeah.
A lot of habits that we learn, whether they be food habits or not food habits, a lot of they're just learned over time. It's a generational thing, like you said. We learn from our parents learn from our grandparents, and it's just this continual cycle. And sometimes it can be for the good, and sometimes it's just not having the knowledge behind why you do that habit and just retraining your mind and thinking, is that what's best for me? Is that what is best for my body?
Yeah. The term food desert has come up quite a bit in different stories across the country, where in certain communities in different parts of the U.S., folks are having to rely on dollar stores or discount retailers to get basic items. Can you talk a little bit about that and maybe your perspective on that?
Sure. Growing up in a rural area, I think that's something that's always usually talked about is, well, we don't have the access or we don't have the capability of, eating as healthy as some people do that live in cities or, can walk right down the street and have access to markets where there's fresh fruits and vegetables. But I think living in Giles County, we have, there's still a lot of healthy foods that we have. I think more and more there's been a push, for more food markets, especially here locally. There's one in Narrows, there's one in Rich Creek, the corner market. You can get some really nice produce there. And Blacksburg being so close, there's all sorts of things there as well. And I think Food Line and Walmart and Grants and, the local grocery stores that we have here, I think they do a really good job with providing foods that are locally grown, that support our area. I think there's a big push for that. But I also think that, you can still find healthy options no matter where you go. You might not have what you think in terms of the healthiest that you could get, but I think there's always an option that you can choose that's better than something else.
Yeah.
So most gas stations these days are going, more towards having, I guess, that refrigerator section to where they do provide cheese sticks and fresh fruit and things like that. So it's just us having to make that choice. We have to realize, hey, we can make better choices with the foods that we choose, even if there's, if we had to choose between an unhealthy and a healthy, maybe before we would choose unhealthy, but now, if you realize like, hey, I do want to try to start eating better, to feel better, there's usually always an option that you can choose to eat better.
Yeah. We talked a little bit about the perception that eating healthier is more expensive, and I think we've addressed that. But are there other myths that you're aware of that people think about when when they consider eating healthy, but maybe push back on that idea?
Yes, that's a great question. I've had quite a few people, besides eating healthy can be expensive, I've had a lot of people who will say eating healthy is so hard.
Yeah.
It's so hard to eat healthy. And my answer to them is, well, it can be, but it doesn't have to be.
Yeah.
It really doesn't. You don't have to think that you have to make this elaborate healthy meal to be healthy. You see all these food blogs and all these articles that talk about these weird ingredients, and you don't have to have those foods. You don't have to have coconut oil and apple cider vinegar to be healthy. I mean, it's not something that these foods that are marketed as healthy. A lot of people think that that's what they have to eat, to be healthy, but it's not, it's just not so. Like I said before, bananas. I mean, bananas are about the cheapest fruit, I guess, that you can get at the grocery store. I buy bananas every week. Eggs, milk. I mean, all these things, beans and rice. I mean, these are all healthy foods that you can make healthy meals out of. A cucumber, a tomato. You can. These are foods that you can incorporate into making healthy dishes, and still, keep it under the food budget and not feel like you're overexpending in the grocery store. And even preparing the foods and prepping the foods, it's something that you just have to make time for. I mean, we make time to do other things. We make time to, do all sorts of other things. So if we really think about the time that it takes to cut up some fresh fruits and vegetables just to have in our fridge that we can easily go and grab, a couple hours every week, and you can plan out a whole week's worth of meals.
Yeah.
I do it every Saturday. We go to the grocery store. Well, now it's just me going to the grocery store. But when I come home, I get my kids involved in the kitchen. We cut up things. We have things in Tupperwares. We put them in glass dishes that they can see through in the fridge. I put all of their healthier snacks like their applesauce pouches and their carrot sticks and their string cheeses at eye level so they can grab them out of the fridge. It's just making it a point, making it a priority, making it part of your life. And for parents, I really encourage you to, start involving your kids. This is something that they can take with them for the rest of their lives.
And you don't have to be Martha Stewart or Bobby Flay.
Exactly.
Right?
Exactly. I think, I didn't have any, really any prep knowledge until I started these nutrition classes. And then you just kind of learn as you go. And, you just do it yourself. You don't have to do it the way everybody else does it. Just do what works for you and your family.
Yeah. So give me your top 5 superfoods, the foods that have the most health benefits.
Okay. Yeah. So I guess now that you said top 5, I'm gonna talk about the 5 food groups. So we have fruits, vegetables, grains, protein, and dairy. So out of the 5 food groups, let's start with fruits. The berries. The berries are where it's at. They're a rule of thumb, I guess you could say, is the darker the fruit, the more pigmented the fruit is, the more health benefits that it has. Okay. So blueberries, blackberries, raspberries, and some might say, those foods are healthy, but they could be more expensive. Well, frozen fruit is where it's at. You can get a whole big pack of frozen fruit, and that's what I fill my freezer with. And then I buy the fruit that's on sale. I buy the bananas and the apples and the oranges. I don't spend a lot of money on the fruit unless it's on sale. Yeah. So the berries for the fruit, that would be my top fruit choice. When it comes to vegetables, the darker the better. The darker the spinach, the kale. That's a little bit healthier than the iceberg, where it's a little bit lighter color. Again, the darker the better. And my husband grew up on iceberg lettuce. I grew up on iceberg lettuce. Yeah. It's okay. It's one of those things that some people are like, I'm not eating spinach and kale, and it's okay. It's it's a slow progression. I kind of mix them. Sometimes I take a little bit of the iceberg, mix a little bit of the spinach. I throw spinach in my smoothies. Your kids will never know. It's kind of one of those things. You can put a punch of green in something, and it's not. It really, you don't really have a taste when it's in a smoothie. Yeah. But so berries, I would say, for the fruit. Spinach and kale for the vegetables, or darker the better for both. Now, when it comes to grains, the third food group, whole grains. And when I say whole grains, I'm talking about 100% whole wheat. There's so many breads and pitas and wraps and all sorts of breads out there. And it doesn't have to be bread. I mean, it can be, like I said, a pita. It could be a wrap. It can be an English muffin. It can be anything, I guess, that comes from whole wheat. But look on the label. Look at the first ingredient. If the first ingredient says 100% whole wheat, then you know it's a 100% whole wheat source. This is important because grains actually have protein, and a lot of people think to kind of avoid grains for the carbs. But if you choose 100% whole wheat, you're actually getting protein. And then you're also getting fiber. Fiber is so important, especially for people who have high cholesterol. Fiber can actually bind the cholesterol, and it will actually lower your cholesterol. So whole grains for the grains. Also oatmeal, that's where that plays into the whole grains as well.
Okay.
Moving on to the protein. So your leaner sources, your chicken, your turkey, your fish, those are your leaner sources. Red meat has kind of gotten a bad rap over the years. As long as you're choosing 93.7 or 90.10, one of those leaner choices, and you drain off the extra fat after you cook it, it's still an okay source to provide your family with a good protein. And then beans, you see this shift between animal proteins versus plant proteins. Mm-hmm. Animal proteins, anything that comes from an animal, plant proteins coming from a plant. So your beans, your kidney beans, your black beans, pinto beans, there's all sorts of beans that you can make meatless meals with. And then peanut butter. Peanut butter is one of those things that, it's a fairly cheap food that you can get a lot of protein, and it's super easy. And
grew up on it.
I mean, yeah, exactly. I mean, I know a lot of people who use peanut butter, and it's a healthy food to have on hand. And then lastly, dairy. Dairy, you can get all sorts of good protein too from dairy. Dairy is one of those foods that you can get from your milk, low fat. When I say low fat, I'm talking 1% milk. That's what we compromise on our family. My husband grew up on that 2% in whole milk, and I grew up on the skim, so we had to compromise somewhere. But the 1% is a good compromise. The only difference in milk is the fat content. The protein is the same. Mm-hmm. The protein is the same in all milks. The fat content is where it's different. And so I tell people, if you can drink a low-fat, just skim milk, that's your best choice, because you don't really need that extra fat. We're getting fat from our other foods that we're eating. We don't need to be drinking it. And then low-fat yogurt. The biggest thing with yogurt that I would say to watch out for is added sugars. Added sugars, that's a big culprit in yogurt. And a lot of people think, yogurt, it's a healthy food. It can be healthy if you choose the right one. But I would suggest going with a non-fat yogurt, but making sure that it has no added sugars.
Okay. Very good.
So I think that kind of wraps up those 5 food groups.
Yeah, and I've learned a couple of things from this, so
okay, good.
Thank you for that. Hey, what about we talked about the good stuff? What are 5 foods we should avoid?
Oh wow, yes. Okay. Well, like I say, everything is okay in moderation. It's all about moderation. I know Easter just passed, and I had a lot of people who loved those, Reese eggs.
Oh, yeah.
And it's okay. Those foods are okay. And I don't think that there's anything wrong with eating those foods. I think there's, the good and the bad. It's kind of one of those things that you can't really put definitive, marks against any food, because every food can be nourishing for our bodies, even if it's nourishing for our souls in some aspect. You just have to do it in moderation. So I enjoy brownies from time to time. That's my go-to. But if I think about some unhealthy foods that I see that people are eating, a big one is just processed meat. Yeah. And when I say processed meat, I'm talking basically any meat that's in a package. Mm-hmm. So that has a long shelf life. So pepperoni and salami, bacon and sausage, those canned meats, those things are okay in moderation, but anything that's cooked that has grease left over that turns into that white waxy substance when left in the pan, that's actually coating our arteries, and it's making the blood harder to flow through to our heart. And so it's not very heart healthy. So that's one thing that I would suggest decreasing is just all the processed meat, the lunch meat.
Right.
You can buy chicken and you can buy ham, and you can cook those things in a crock pot, and you can slice them yourself, and you can easily, decrease the amount of sodium that you're eating by just making a simple switch.
Probably cheaper to do it that way too in the long run.
It really is. Yeah, I think you have to take a little bit more time to do that, but over the long run, it's cheaper and it's more heart healthy for you.
Yeah, and then nutrition obviously incredibly important, but really at the end of the day, it's just one component of trying to have and maintain a healthy lifestyle. Wouldn't you agree?
Yes, I would agree. I think nutrition plays a big role in our lives. Like I said, food's everywhere. We have to eat. It's kind of one of those things that we're always faced with decisions. What are we going to have for breakfast? What are we going to have for lunch? And most importantly, what's for dinner? It's one of those things that everybody asks, what are we going to make for dinner? And, it's something that you do day in and day out. Every day you have to make a choice, and we can choose to eat healthy. We can, choose to enjoy those foods that are not so healthy, as long as we're doing those in moderation. But for the most part, the better you eat, the better you're going to feel.
Yeah. Any parting words of wisdom or a takeaway to leave with our audience?
Yeah, I just thank you for having me. I think nutrition, this is my passion. I'm here to help anyone who has questions. Insurance companies are paying for these services. So if you would want to, sit down and ask me some questions, I'm doing all of my appointments now via web conferencing. So it's actually very nice. I can see you. I can be in your kitchen. You can show me your foods that you have on hand. And I'm kind of liking the working from home and, being able to see my clients within their own house because they can show me what actually is in their kitchen.
Yeah,
and
that's a great point.
I can give them a better idea. When I can help clients more when I really know exactly what foods they're talking about, what they have on hand. And for insurance is paying for this service, why would you not want to, try to improve your health?
Right. Our pantries and refrigerators say a lot about us, don't they?
Yes, they do, for sure. That is correct.
Emily, if folks do want to follow up with you and ask questions or find out more about your practice, what's the best way to do that?
Sure. I have a website, cooknutritionllc.com. I can be reached by email, cooknutrition@gmail.com. I'm on Facebook and Instagram at Cook Nutrition, or my phone number is 540-599-9378.
Awesome. And we will include links to all those in our show notes for today's episode.
Great. Thank you, Mike.
Emily, thank you so much again for your time and the tips that you've shared. I think this is great information and that will be incredibly helpful to our listeners. So thank you again.
Thank you. Thank you for the opportunity.
We hope you've enjoyed this episode of Dissect and Connect. For more information about Montgomery County Prevention Partners, our New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org.